everyone. Thank you all for being here today. My name is Bailey Madsen and I am a USU graduate student. Today we had all of the nursing staff and hospitalists and bedsides meeting together so that we can do a little training on the inpatient diet orders. So, did somebody say food here? At the hospital, food is something that's very important. And all of you play different roles in what the food looks like for patients. And one thing is that food means very different things for a lot of different people. But no matter what we put into our bodies is really important. And what we put into our patients' bodies is even more important. As a nursing staff, hospitalist, all of us together as a team have the biggest impact on what patients' recovery status looks like. And nutrition is something that is often overlooked but has one of the greatest impacts. So today, our learning objectives, by the end of this presentation, all of us will be able to describe what is included and restricted in each diet that a patient can be prescribed to, and we will be able to incorporate habits of reviewing patients' current symptoms, eating patterns, and diagnosis to ensure that the diet is prescribed for them promotes proper healing. And so with that, one of the biggest things is whether you're the person that's delivering the food, prescribing the diet, or maybe just taking their vitals, you're the ones that are in with the patients. There are only, in our hospital, there's only one dietitian per floor. Some hospitals, there's even less than that. The dietitians and diet techs can't see every patient every day. Typically, we don't even see all of the patients that ever come into a hospital. But between all of us, we're seeing them constantly. And maybe there's patients that trust you more because you're in there every single day. They feel more comfortable being honest. Or maybe there's patients that you notice certain things of what they are and aren't eating. And so as we work together as a collaborative team, we can make sure that our patients are getting the best nutrition so that we are better at our jobs and that their quality of stay is better and their likeliness of coming back is decreased. So, we're going to go over all of the different diets, or just a few that we can go over right now that are most popularly prescribed. And the first one is the cardiac diet. This is going to limit sodium and as well as fluid. One thing that's really important with this diet is it doesn't just restrict water that patients often think. It's anything that will turn into liquid as they're digesting it. So things like ice that will melt, milkshakes, ice cream that are also considered liquids, and any pop that they're drinking or coffee or any other liquid is going to be a part of that. And these are the patients that this diet's best for patients with heart failure, or maybe they have fluid edema, we want to restrict that. And also when there is any hypertension or coronary artery disease as well. And we're really just trying to reduce the stress on the heart so that they can have a reduced risk for further damage. And then the next diet is the International Dysphagia Diet of Standardized Intervention, or the IDDSI or IDSI. And this is for our patients that are having difficulty chewing or swallowing, and really it's just to help them get more food down. This is something that could be really important when patients sometimes are avoiding food, harder foods, tougher foods, or even thinner liquids, and they're at a risk of aspiration. We offer a lot of different foods that are minced and moist, or we also thicken liquids, so that they can have a more pleasant mealtime experience. And with the IDSI diet, one of the most important things is to work with the speech-language pathologist. And we don't have them here today, but as we work with them, we can make sure our patients are on the right level of diet. This one is a pretty popular one that we see, and it's the consistent carbohydrate diet. Typically, this is mostly used with our patients with type 1 or type 2 or gestational diabetes. It's really to help patients manage their blood sugar. They may be on insulin, they may also be pretty controlled themselves, so sometimes they don't need this, but typically it's just to have them have the same amount of carbs throughout the day for each meal in order to manage that blood sugar. And patients sometimes are very familiar with this, but Typically, we most likely see the medium carbohydrate diet, and that's 75 grams of carbohydrates per meal. And the final diet that we're going to go over today is the renal diet. And this is a very restrictive diet. It's low sodium, low potassium, low phosphorus, and low protein as well. And this is typically mostly beneficial for patients that have end-stage renal disease. If patients just have chronic kidney disease, it's likely going to be more harmful with how much it's limiting them and they're not able to eat. But it is really to keep those kidneys from overworking. So that is a really restricted but can be extremely beneficial for those patients. So next we're going to do a learning check. Kind of see, I just threw a lot of information at you. Want to see what you have absorbed, and if we have any gaps in our knowledge, we can have questions and go over each question. So if you can pull out your phone, we're going to get to Kahoot. So if you pull up the Kahoot website, and I will be able to get you that code. There's going to be a box to enter, and there's going to be a game pin. And the game pin is 9128821. And if you haven't used Kahoot before, there's a place where you enter your name so that we can see our participants. Thank you, Ben. Perfect.
Okay.
Yeah.
Hit okay up there in the black bar. There.
Perfect. Okay, so I'll read the question out loud, and the answers are going to be attached to colors. And you're going to select the colors and shapes will pop up on your phone. So if you think blue is the correct answer, you select blue on your phone. So when that pops up, it won't pull up the question on your phone, only up here, and the answers will be up here. But I'll read them all as well. Okay, so this is just going to be a review of the diets. Okay, so the first question is, you notice a patient is frequently coughing after sips of water and bites of food. What is your next step of action? Red, try to get the patient to eat more. Yellow, ignore it. Blue, reach out to the speech therapist. Green, immediately switch diets. Ben. Perfect. Reach out to the speech therapist. That is what we're going to do. They have the most training on the IDSI diet, obviously, but it's something also, another thing that we can do with patients is instead of limiting their diet to an IDSI diet, we can also have them just order things off the dysphagia menu. They can order just maybe their turkey minced and moist, but they can not be limited to just that diet. It's something we can do to kind of help them be able to get their nutritional needs. Okay, looks like Cindy's in first. Okay, true or false? A cardiac diet limits all types of fluid, not just water. Blue is true, red is false. Perfect, 100%. So the cardiac diet, like we talked about, it's going to limit sodium and fluid. And the fluid is not just water. It's any liquid that's going to go in and turn into fluid and cause potential fluid accumulation. And that's why the sodium is also there to limit how much water retention the patient has. Okay, Rod took the lead. Okay, the next question. Which diet is used to control a patient's blood sugar? Red is the consistent carbohydrate, yellow, cardiac, blue, IDSI, green, renal. Okay, yes, perfect. The consistent carbohydrate. It's going to limit the carbohydrates throughout the day so that they are able to have more balanced meals of their blood sugar spikes, and also when it working with insulin, if they're on insulin, it can be more manageable as well. Okay. Final question. Which of the following does a renal diet not limit? Sodium, red, yellow, potassium, blue, phosphorus, green, carbohydrates.
I'm sure I got that wrong.
Yeah, it's carbohydrates. And just for that, that is the one that is really restrictive. If it were to restrict a protein or a macronutrient, it would be the protein. Does anyone have any questions about that renal diet or any of the other ones? Okay. Well, perfect. That was the end, and it looks like we can get the scoreboard. Looks like Rod took first. Everyone can give it up for Rod.
Was that for punching it in the fastest?
Fastest and right.
Well, I can know that. Okay.
Okay, perfect. Well, the last thing we're going to go over today is putting our skills to the test. So, we've kind of gone over the main diets today and how important your role is as a caregiver to make sure that our patients are getting the best care. So, we're going to go over a situation of a case study, and we're going to just see if we have any group ideas of what went wrong, or not maybe what went wrong, but what could be done to fix this medical diet order so that our patient can get maximum energy and nutrition needs. Cindy, can you read that?
Mm-hmm. Out loud?
Yeah.
Oh.
Do you want it closer?
No, it's good.
Okay.
Is that MJ?
Yeah.
Oh. MJ is an 87-year-old male who was admitted to the hospital 2 days ago for a right hip fracture. He has a medical history of ischemia, type 2 diabetes, and dementia. Upon an admit, he was placed on a cardiac and CCHO diet. His BMI is 18 and only orders when his wife is present. The wife complained to the CNA that he is unable to order a boost supplement he likes because it is too high in sodium.
Okay. Anyone have some thoughts about what may have gone, what we could do to fix it? So, he's on a cardiac and consistent carb diet. Does anyone remember what those things might limit him?
Well, the carbs would be bad for him.
Yeah, he's limited carbs. He's limited to 75 grams of carbs a day.
Yeah.
And the cardiac diet is going to limit two things.
Liquid?
Liquids and carbohydrates.
It's going to be sodium.
Sodium.
So he's limited to carbs, sodium, and liquid.
Mm-hmm.
And the one thing that he wants is the boost supplement, which is those protein drinks that we bring in.
Yeah.
And the one that he wants is particularly high in sodium. And now typically this wouldn't be much of a problem, but it does look like if he's 87 years old, a BMI of 18, which is borderline underweight. He's not underweight yet, but he's definitely on the low end of normal. He had a hip fracture and he's not eating very well. One thing, does anyone have ideas of what we could potentially do to help him?
Well, can't you get a boost supplement that doesn't have so much sodium in it?
That's definitely a possibility. We could look and see if there's any other options for supplements that he could have instead. And then another thing we could also do is reach out, depending on your position. If you're a hospitalist, obviously you have diet order writing privileges, and the dietitians do now as well. But potentially working with one of them, if you are a bedside noticing this, of liberalizing this diet, of maybe removing the cardiac diet and only keeping him on a consistent carb so that he can get nutrients. Because for him, he looks like his cardiac problems are under control. So we could liberalize that so he could get food into his body, nutrients, Or we could also just, give him different supplements as well. That's a super great option. Okay, so in summary today, we've gone over the difference between the different diet orders and how essential each of our roles are in making sure our patients have the best patient care and that you guys are doing your jobs the best possible. And it really shows today that the diet orders have such a significant impact on our patients' care. Does anyone have any questions? Okay, perfect. Well, thank you so much. Please, if you could fill out your post-training surveys after this, and everyone have a great rest of your day. Thank you.
Thank you.